The patient sat rigid in the chair, trembling not from his stutter but from fear. The surgeon raised a scalpel, leaned forward, and with a swift movement cut deep into the tongue, slicing away a wedge of living flesh. Blood filled the mouth, pain radiated through the jaw, and hope mingled with horror. This was hemiglossectomy, a 19th century cure for stuttering, and it left behind scars that were physical, psychological, and cultural. Stuttering has existed throughout recorded history, and for centuries it baffled physicians. In antiquity, treatments ranged from herbal remedies to bizarre superstitions, often focused on the tongue as the source of the problem. By the 19th century, medicine was advancing, but understanding of speech disorders remained crude. Many doctors believed that structural abnormalities of the tongue caused stuttering. The solution, they reasoned, was to reshape or reduce the tongue itself. Thus emerged hemiglossectomy, the partial removal of the tongues, a supposed therapy. The procedure was brutal. Surgeons would clamp the tongue, cut away a triangular wedge, and cauterize or stitch the wound. Patients endured excruciating pain, excessive bleeding, and high risk of infection in an age before antibiotics. Mortality was not uncommon. Those who survived often found their speech worsened, permanently impaired by the missing section of muscle. Instead of curing stuttering, the surgery frequently destroyed the ability to articulate words at all. The practice gained notoriety in the mid-1800s, particularly in Europe. Surgeons defended it with optimism, publishing case reports that exaggerated successes and downplayed failures. In reality, few patients improved, and many were left mutilated. Critics within the medical profession soon began to condemn the operation as misguided and dangerous. But for desperate families, the promise of a cure was compelling, and some continued to submit to the knife. Hemiglossectomy, for stuttering, reflects a broader theme in medical history: the tendency to conflate visible anatomy with complex disorders. Because speech emerges from the tongue, it seemed logical that cutting the tongue might solve disruptions in fluency. But stuttering is a neurological condition, involving timing and coordination in the brain, rather than flaws in the tongue's structure. The surgery treated the wrong organ entirely, with predictably disastrous results. By the late 19th century, as medical science advanced and antiseptic techniques improved, the procedure declined in popularity. Speech therapy, pioneered by educators and specialists, offered more humane and effective approaches. Still, the legacy of hemiglossectomy lingers as one of medicine's darker chapters. A reminder of how little was understood about speech in the human brain. The story of tongue cutting for stuttering also reveals the vulnerability of patients seeking cures. Stuttering carried intense stigma, often interpreted as weakness, nervousness, or even moral failing. People who stuttered were ridiculed, excluded from professions, and burdened with shame. In that climate, any promise of relief, no matter how brutal, was tempting. Surgeons exploited this desperation, turning the knife into a false beacon of hope. Today, hemiglossectomy for stuttering is remembered with shock. Yet it is part of a long tradition of misguided medical practices rooted in misunderstanding. Just as bloodletting sought to balance imaginary humors or lobotomy attempted to cure mental illness by severing brain tissue, tongue cutting embodies medicine's struggle to grasp the invisible workings of the body. Each era of medicine produces treatments that future generations view as barbaric. Modern research shows that stuttering has neurological and genetic underpinnings, not anatomical defects of the tongue. Effective therapies focus on speech techniques, psychological support, and in some cases medication. The scalpel has no role. But the ghost of hemiglossectomy remains as a cautionary tale. When science is lacking, medicine often substitutes violence for understanding. The next time you hear someone stumble on a word, consider the history of those who were once silenced not by their stutter, but by the knife.